Hello, good afternoon, everybody. Or not afternoon, good morning, technically speaking. I keep having to remind myself that the Caregiver Noontime events end at noon instead of start at noon. I think I'm getting a weird bit of echo here. Mute that. Check, check. One, two, three. Okay, perfect. So, good morning, everybody. Welcome to the Caregiver Noontime Knowledge event. Just a couple of ground rules before we get going, and I know many people have been here before, so I just want to let you know, not going to do it as good as Lori, but I'll try my best. She gave me the list, so we have hope. Um, Before we get going, restrooms are right down the hall and to the right before you get to the kitchen. So if you need to use those, please go right ahead. Um, In-person attendees, you should have done, if you're getting CEU credits, you should have done a check-in outside. If you have not done so and still need to check in or want to check in, we can just catch you right at the end. For anybody that has checked in for CEU credits, we are asking you also to check out. It will be the exact same form. It'll just be at the end so that we've got you for the full block of attendance. Let's see here. You know the rules. For Zoom attendees, hello, Zoom attendees. Everybody in person, wave hi at the Zoom people. They can't actually see you, don't worry. For Zoom attendees, you do not need to worry about the check-in and out form if you are getting CEU credits. Your attendance has automatically been tracked for you on Zoom. However, for both in-person and virtual attendees, and I should actually, I think, pull up this specific slide, if I can find the button for it. There we are. Please work. There we go. Is that the slide that we were? Heavens to Betsy, Lori really does this better than I do, doesn't she? Um, so there, okay, check, check, check. Okay, yes. So this is for Zoom attendees. Anybody that is on Zoom currently, then please take a look at this. Just make sure that you have your full name that is visible. Make sure that you are muted, that your camera is off. And then, of course, open your chat window. If you have any questions for our speaker, we will be relaying those questions to her. So if you have any questions, please ask them in the chat and we will make sure that those questions are answered. For everybody, please make sure to do the evaluation at the end of the course. If you are getting CEU credits, that evaluation is necessary. For those of you that are not getting CEU credits, we do still ask for that you do the evaluation, mostly just because we want to make sure that we're doing a good job for y'all. And this is the best way to say, hey, this was fantastic, more of this, please, or hey, not the greatest. Here's what could be better. So please let us know one way or another. We will ask that you do the attendance even if you're not getting CU credits. And then that will be live until noon on Friday. QR code on slide. And the QR code for that evaluation, if you do QR codes, we will also have a computer if you don't do QR codes, but the QR code will be on the slide at the end of the presentation. That is all the reminders that I have until the end of the session. So, without any further ado, I will quit my yapping and pass it off. Here you are.
So, thank you all so much for being here today. Can you hear me okay? Okay, great. I'm pretty loud, but I'll still use this for the people who are online. And I'm going to see, does the clicker want to work for me? Okay, good. It does. Excellent. Okay, so just to introduce myself, my name is Dr. Andrea Meluch. I'm an associate professor of health communication in the School of Communication at the University of Akron. I got my PhD from Kent State University in 2016. I'm originally from Northeast Ohio, and my research really focuses on the experiences of individuals within the intersections of health and organizational life. So there's kind of two ways I look at it. The first way is probably what you are most interested in today, which is kind of our experiences navigating healthcare as patients and caregivers. So I've done a lot of research looking at things like patient-provider communication about prescription drug costs, patient-provider communication about informational support for breast cancer patients. I've also done quite a bit of research looking at experiences of employees in the workplace, dealing with things like mental health disclosure and burnout, and a lot of that came around too with COVID-19. And so I kind of just look at like how these organizational forces, whether it's culture, policies, rules, structures, how they influence our experiences as whether it's employees or patients or healthcare providers or what have you. So, um, okay. Okay. So that's a little bit about me. I teach mainly communication courses at the undergraduate level, but I also am the graduate coordinator. We have a graduate program. And within the graduate program, I teach classes like health communication, risk communication, organizational communication. And so it's really great because I have the opportunity to really look at my research with my students and, continue to expand it and collaborate and things like that. And I also am really excited when I get to come out in the community and do events and talks like this. So thank you for having me today. So when I teach, whether it's an undergrad class or any presentation, really, I like to just give everybody an idea of where I am going because I know as an audience member it can be frustrating when you're kind of like, where are we in the presentation? So I'm going to start with talking about the caregiver role, which obviously, if you are a caregiver, you understand this. This is your lived experience, but I just want to define what I mean by that so that we're all on the same page. Then I really want to go into these strategies for effective doctor-patient communication, especially doctor-caregiver communication. So we'll talk about how to prepare for medical appointments, how to communicate effectively with our providers, what are the right questions, strategies for asking the right questions. And then I want to come back around to that role of being a caregiver and talking about some of the challenges that caregivers face, because I think that that is a really key component of the experience of being a caregiver and one that is easily overlooked. And there'll be time for questions and answers. And I also like case studies and making things interactive too. So, okay, this is going to not like me today. Oh, there we go. All right, here we are. Okay, so there's a couple different definitions for the term caregiver. Sometimes it's referred to as healthcare providers within, our hospital systems. But what I'm talking about today when I use the term caregiver is individuals who provide physical and psychological support to someone that they care for, usually a loved one. It could be a parent, a child, a spouse, and it is someone who is unable to take care of themselves fully due to some type of underlying medical condition. And obviously, there's so many examples of this. I just lost this past summer both of my grandmothers to dementia, so I really saw kind of the toll that that takes on family and family caregivers there. But obviously, I have personal experience too with family members dealing with cancer. So many examples, Parkinson's disease, stroke. So many examples. But one of the things to keep in mind with these caregiving responsibilities is that they're often unpaid when they are done in this way, in kind of this less formal sense where we are taking care of a loved one. And sometimes you can feel rather unseen too when you're doing caregiving. So what I mean by that is that, caregiving, when it's not compensated, when it's not, recognized by, our structures in our society, even though it is taking up, it can become your full-time job. That can feel really difficult as an individual because, you are giving yourself to this really important task that may not actually be, given the appropriate attention or sometimes even feel like the appropriate respect within different contexts. So with that, as caregivers, Common responsibilities, daily routine help. So, dressing, bathing, household chores, transportation, taking loved ones to and from doctor's appointments, preparing meals, managing medications, which can get so complicated, especially when there's really complex health issues going on. I know when my father had his triple bypass, and I'm pretty on top of things with healthcare, but we came home and I sat at the kitchen table with my mother and my sister, and we had all of these medications that we had to figure out for him, and it was very overwhelming. And so with caregivers, that's just one more element of it. Finances, a lot of times for caregivers, especially if you're taking care of, an elderly adult, you have to deal with the financial situation that comes along with it, and there can be a lot of legal aspects of that as well. Keeping an eye on their health. So noticing, whether it's a big change or subtle changes related to your loved one's health. And then this is really where my focus is in my research and my background, which is advocating and communicating the needs of your loved one to healthcare providers and or other agencies. So, you really become this conduit as a caregiver a lot of times for your loved one when they can't communicate or advocate on their own, or maybe they have some limitation there. So, within the health communication literature and the healthcare literature, what we know is that it's important for patients to make effective decisions about their health. And as caregivers, when we are in charge of making decisions for our loved one's health, we similarly want to make those effective decisions. So, what does effective decision making look like in healthcare? Okay. And I should say that this is a communicative process. All right. We are taking in information when, we're a patient, and we are trying to weigh, what is the best option available to us through this interaction that we're having with our provider. So, some of the key aspects of effective medical decision making is first to have the best clinical evidence available to us and use that. But most of us are not trained medical professionals. And so it's hard to understand this clinical evidence sometimes. And that's where our provider comes in and really being able to translate these things for us. I don't know if you've ever gone online and tried to, search through PubMed or, medical jargon, and it can get really overwhelming. It can get very scary really quickly. And so we're relying on our providers to present that to us so that we have that information available to us to inform our decision. Next, another aspect of effective medical decision making is to prioritize the patient's values and preferences. When it's our own decisions related to our medical care, we know what our values and preferences are. We know what quality of life we want, what our expectations are. But when we step into the role of caregiver, we need to figure that out and make those decisions on behalf of someone who may or may not be able to fully, explain their wishes. And that can be a real challenge, especially if you hadn't had that conversation ahead of time with your loved one. So I know this past summer when my grandma became extremely ill, I remember sitting there with my family and just, really kind of feeling almost at a standstill because we were like, we don't know what she would have wanted at this point. Would she have wanted to continue to try this medication? Would she have wanted to change care? And so we felt like we were put in a position where like we started to have to make these decisions. And how do they relate to her values? How do they relate to how she lived her life? And you might think you know someone deeply, and yet you can still feel overwhelmed by those decisions. We want to make sure that there are opportunities for patients and or their caregivers to be involved in the decision-making process. So within a healthcare, context, if you've ever gone to the emergency room, sometimes you might feel rushed and you might feel like, hey, this is the information that's just being presented to us and this is what you're going to do. But that isn't effective decision-making because really it should be a shared collaboration between all of the parties involved. So you want to make sure that all voices are heard, and it's not just a provider saying, no, this is what you need to do, or this is what's going on, because that can be really frustrating. It can be frustrating when patients don't feel heard. It can be frustrating for individuals who especially aren't able to advocate for themselves, to feel that, they're not being seen. And then it can be frustrating from the caregiver perspective as well, if you don't feel like you are being listened to within this context. And then finally, with decision making, we want to weigh the feasibility of treatment options. So if you've ever been to the doctor, you've probably been told, eat healthier or exercise more or do this treatment option, and you go home and sometimes you're like, yes, I can do it. I have the ability and the capacity to make these life changes. And then sometimes you go home and you're like, it's just not in the cards for me. I don't have, I have two young children. I don't have the time to, spend, working out for 2 hours a day or something. I don't have childcare for that. So sometimes, we need to take into consideration, what is feasible for us. And so as caregivers, if, there's some type of physical therapy or at-home therapies that you're being asked to do with your loved one, but if your loved one's uncooperative or unable, like, what is the feasibility of that treatment option? That needs to go into this decision as well, of what to do to move forward. So the decision making within the healthcare context of healthcare providers and caregivers should be shared. It should be this collaborative process where the patient is involved as much as they can be. And I say can be because there are some conditions where, the patient may not be able to have that voice. And so again, you have to make those decisions for them. And that is really, really stressful and challenging. And so, as a caregiver, we undergo extreme levels of emotional stress and even sometimes conflicting attitudes about prognostic information. So you may receive information from a provider about, like, this is what we're looking at, but, you might know anecdotally, well, my friend Sharon's mom experienced something different. What if things turn around, or I don't know if I agree with this, or, they've bounced back before. Sometimes it can be really difficult to kind of, weigh all of these feelings and emotions that we're experiencing. And can also be hard to hear bad news. And within the healthcare context, this could be unfavorable outcomes. It's never fun to receive bad news from a healthcare provider. It's always a real challenge. We don't like to hear bad news in our life, whatever it might be. But, it can be really hard when you're hearing it about a loved one and you just feel like there is, nothing that you can do to change this. And so that can be a difficulty for you to process even. Um, Another challenge is being able to communicate needs and concerns effectively. We can be extremely intelligent, articulate people, and then when we walk into a healthcare environment, that can all go out the window. I know when I had my babies and some other health emergencies, I felt like I was not a capable individual. Whereas in other contexts, I've been asked repeatedly by healthcare providers, oh, do you work in healthcare? And it's like, well, I have a PhD in health communication, so I have this background. But I know sometimes when I'm in the seat and I'm the patient and I'm overwhelmed, it can be really hard to be able to explain ourselves. And so even though I know these strategies, it's okay to recognize that when you are stressed, when you are actually, faced with, life or death or major health issues, it can just be overwhelming. And then finally, another challenge is being able to work with providers who actually listen empathetically, and they're providing enough information to us. If you've ever been in the emergency room, you might realize, a lot of times providers are extremely rushed. My sister, about a week or so before Thanksgiving this year, she came down with salmonella poisoning, which if you've never experienced it before, which I hadn't, it is extremely terrible, like just the worst pain. I had no idea what was going on with her, and I had taken her to the emergency room, and we had gone on, a Thursday night, and they were just completely, we sat there for hours and hours. They rushed her in and out. She didn't feel well. She didn't feel like they were actually listening to her, and she ended up having to go back the next day I ended up having to go back with her the next day. And she was admitted, and eventually through testing and everything, they figured out what it was and they were able to get her the antibiotics. But, that feeling of not being listened to, not being understood, going home frustrated, that is a real challenge, especially because we can't a lot of times choose our providers. When we walk into the emergency room, it's who's there, who's assigned to us. So, ideally, we're going to have providers we like and we trust, but that's not always the case. And that can be a real challenge as well. So, some additional barriers that we can face with advocating and communicating in healthcare, uncertainty and its influence on decision making. So, part of health is the unknown. That's part of daily life, and we usually manage it because we feel like we have some level of control over things. But once we kind of get into these contexts where whether it's our loved one's health or our own health is kind of, at the forefront, we start to realize we don't have the answers. We don't know what's going to happen. And it can be paralyzing. It can create a lot of fear, a lot of anxiety, and a lot of stress. And, if you're like me, I'm a controlling individual in my life, those moments can be really, really overwhelming. I know, like when I had my son, and it was the first time I had a baby, my firstborn, and I was just like, I feel like I am a science experiment. I feel like I am no longer in the driver's seat of my own body, and that was really, really jarring to me. So. Another challenge that we face is that providers, whether they're physicians assistants, have a tendency to interrupt us while we're speaking as patients. The statistics I was able to report, and these still hold true, going back into the 80s and 90s, is 77 to 72% of patients report being interrupted by healthcare providers before they're able to fully state their concerns. I would say that, the patient satisfaction, patient-centered care movement has probably changed these metrics a little bit. I think things are a little bit better today, but think about your own interactions with your doctors and when you might hear you're starting to explain something, well, let me stop you there, or let me stop. And that can be a frustrating thing to hear because you feel like you haven't really been able to fully explain what's going on, whether it's with ourselves or with our loved one. And then also, we live in a system where health disparities exist. Women report higher rates of being dismissed by healthcare providers. Women repeatedly report that their pain is not taken as seriously as their male counterparts. I know my husband, he had his vasectomy, was sent home with all this pain medication. I had a C-section and I was sent home with Tylenol, just very different experiences from women to men. And that's just, kind of a lot of how our healthcare system has traditionally worked. Even in terms of the research, a lot of times they focus, medical and biomedical research on male participants, male mice. They don't always even include females in the sample. And so that has outcomes down the line. And then people of color historically experience poorer health outcomes when compared to their peers. We see higher rates of chronic disease, more comorbidities, higher mortality rates, and things like that. Black women maternal mortality rates is one that's been covered in mainstream press a lot recently. So, with all of this in mind, we want to make sure that when we go into a healthcare setting, especially a healthcare appointment as a caregiver, and also just as a patient ourselves as well, that we are prepared and that we're able to do a good job for ourselves. And so, this starts before we ever walk into the doctor's office, before we ever get to that lobby. We want to make sure that we're prepared to be able to discuss our needs and to really make sure that we're making the most out of this appointment. So one of the things that we want to have available to us is obviously any medication information that our loved one is taking. This can include over-the-counter drugs and supplements as well. That's really important. I think it's easy to forget, oh, Tylenol, I gave, my kid Tylenol or something, like things that we might not even realize, but that can be really important to remember and have, noted or just there in our memory. We want to be able to document symptoms, concerns, and major life changes for our loved one. So We want to make sure that we're accurately reporting things. We don't want to kind of come up with in our mind a story of like, well, why is something happening? But just more reporting like, what have we actually observed? So if we've seen our loved one more forgetful, or if we've seen our loved one falling more often, or if we are if there has been a major change where they've lost a lot of weight or something like that, we want to be able to document those things so that it's clear to the provider and we don't forget something. Um, One of the key things that we want to do is write down questions and potential follow-up questions. We want to make sure that we prioritize our questions. So what is most pressing? What do we want to get to first? And then kind of what is least pressing? I know whenever I take my kids to the pediatrician, I always have in my mind, I got to make sure, for their well checks, or if any appointment, I'm going to ask this, this, and this. These are the things I'm most concerned about here at the moment. And I realize that, I want to make sure I ask the most important things first because we may run out of time. And those lesser important things like, hey, I can't get my kid to eat a green vegetable. It may not be as important as, oh, they keep getting this rash, things like that. Confirm appointment and review your My Chart. This is, as a caregiver, so useful and so helpful. And I will be honest, I am not even great at this. I actually missed an appointment last week, a dentist appointment, because I had double booked things because it's that time of year for me. And so always review appointments and review your calendar and make sure that if you can do pre-check-in, do those things for your loved one. It really can help make things go smoother and make sure that nothing's missed. And also when you're doing those things at home on your own time, you don't feel as rushed as when you're sitting in a waiting room or an examination room. So once we're actually with our providers, we want to make sure that we are practicing an assertive communication style. And it can be hard for some of us to be assertive because a lot of times we confuse assertiveness with aggressiveness. Okay. So assertiveness is really stating our point, making sure that we're clearly understood, not being willing to kind of like veer off or be, over having somebody over talk us or anything like that. Aggressiveness is when we are, actually being argumentative or in conflict with a provider. And so we don't want to be that way. We don't want to blame or, be negative, overly negative in any way towards the provider, but we do want to be assertive. We do want to make sure that our points come across. So ways we can do this is be honest and detailed. Okay. Provide the details that you think are relevant. Provide what you've seen, what you've experienced as a caregiver. If you feel rushed, if you feel confused, if you feel intimidated or dissatisfied, be willing to state those things. They need that constructive criticism sometimes to realize if something is not working out. And it can be hard to say these things, especially because in our society, physicians, MDs, DOs, they are placed at a level of authority where traditionally, historically, we haven't really questioned their authority. I think that has changed in recent years for the better and for the worse in some ways. But it's important to be able to say to our providers, no, I'm confused about this. I don't know what you're saying. I don't understand what this point is or, what this treatment is looking like. Can we please take a step back or can we, please talk about this more? It can be hard to do that because again, like we can feel intimidated. It's just part of our culture, especially in this country where we have really placed a lot of power, authority within our healthcare institutions over kind of how we live our lives and, how we structure our society. Let our providers know if you need them to speak slower, louder, or more clearly. Again, they can be rushed. Sometimes there is a language barrier there and it can be hard, to understand somebody very well. Sometimes providers are like me and they just talk really, really fast, So it's important to be able to state that and that way they understand what you're experiencing. Be sure to use I statements instead of you statements with your provider. So I'm feeling like things are not being explained very well, or I'm feeling like I'm not understanding this. That can help, redirect the issues towards the experience of the caregiver or the patient instead of making a provider feel defensive. Okay, because they're people too, you know, and they're not without their flaws. And if you come in and you say, well, you're not explaining this well, or I don't get you, it can put somebody on the defense. And so we don't want to do that. We want to be assertive without creating additional conflict. So that just kind of, again, hits on that last bullet point of avoid blaming, avoid attacks on the provider. I know that violence against healthcare providers has gone up substantially in the last few decades. And has anybody watched the television show on HBO, The Pit? It's about a emergency room in Pittsburgh. Really well done. Like the best medical drama I've ever seen. And I've watched them all, just being a health com person, communication. We like media too. And it really shows like some of how like frustration, how stress, how things can erupt, and be taken out on providers. And so it's important to manage those emotions and ensure that we're approaching them as people as well. So with a caregiver, there are three parties in the room, sometimes more if there are multiple family caregivers present. But the key third party is the patient themselves, the care recipient. And so we want to include that individual in the conversation as much as possible. If you have taken care of somebody who, can somewhat advocate for themselves, but not fully, that it is a really delicate balance between providing the information on their behalf, but also letting them speak for themselves as well. So if they can answer questions, you need to step back. And if you are a person who is just naturally, you want to answer all the questions, you want to be really assertive, that can be something you have to remind yourself of. No, I'm going to let my loved one, speak now. I'm going to take this step back. And sometimes, as a caregiver, we have to give ourselves that reminder, so that the patient is able to have a voice in the room if they're able to. Another thing we don't want to do is we don't want to engage in a two-way conversation with the provider where the patient's just kind of sitting there as a spectator. This is about them. This is about their life. And even though what happens, the outcomes are going to have a huge impact on you as a caregiver as well, you want to make sure that they don't feel that they are being left out of this decision making. It should be shared. And it can be a challenge, and if the loved one, the care recipient, is unable to participate, and I saw that this summer with my grandmother with dementia, I found it jarring at some points talking to like the nurse practitioners and things with, she's there in hospice in the room and we're talking about her like she's not there. It almost feels like completely wrong to speak about someone that way when they're still physically breathing there. So another strategy we want to make sure that we're always using is reflective listening. And this is where we're actively listening, but we're also trying to confirm understanding through our listening skills. So that's where, if a provider says, I want you to, try to walk more, we can show our reflective listening skills by saying, what I'm hearing is you want me to walk more. So it might sound, silly, but like that gives us confirmation of we understand. We're not missing something. Okay. Take notes to help remember details. I am still a paper and pen person, and I like having paper and pen with me. I know a lot of people in my generation, and especially the younger generations, are all on their phone. That's fine too if you like your phone as well, if you like notes apps, things like that, as long as you're able to do it, as long as you have those tools available for you. But make sure that you have it with you, have that paper and pen, in your bag or purse or what have you, because it's really hard to remember when you're actually sitting there in a conversation all of the details. Again, we want to make sure that we're focusing on factual observations. We want to avoid conjecture and just report the facts that we've observed. And this can be really, really challenging sometimes because, again, like, humans are storytelling creatures and we want sometimes to provide narrative and context and background, but that always doesn't get the information out as clearly and objectively as maybe a provider needs. And with that, we want to make sure that we're discussing our concerns and feelings in productive ways. So even if we are feeling frustrated with, our loved one, the care recipient, or if we're, seeing things that we find troubling, we can report those feelings, we can report those observations, but we want to make sure that we are framing them in a way that's going to be helpful for the provider to understand. And then if the care recipient requests it, be willing to step out of the room, be able to provide them with privacy. It can be hard because if you're doing this job 24/7 and this is your life now and you're told like, hey, I want you to leave for a minute, it's not easy. I mean, I think as a parent, I know like, eventually someday when my kids tell me, hey, I want you out of the room, I'm probably not going to be very happy about it. But it's important to give people privacy and autonomy because it is their health, it is their life. And if they need that, if they want that, we should respect them as individuals. So I have this quick video. It's from the NIH. It really just kind of summarizes a lot of what I just said. And I think it's really useful and kind of a quick, uh, again, summary of these tips to kind of just reinforce them. So let's see if I can make this work. And the volume is, okay, hold on one second. The good thing is it's not very long, so. Is there a way we can turn up? Okay, awesome. I figured you were coming to help. Okay, thank you, Bridget.
Share computer
Okay. Okay.
5 ways to make the most of your doctor visit. Being able to talk with your doctor.
Why is it doing it on here but not there?
Well, if we can't,
That's going to be really.
yeah, I can make the YouTube a link available to everybody as well. I'm happy to share my slides or anything, and
5 ways to make the most of your doctor visit. Being able to talk with your.
Yeah. I'm so sorry. No, it's okay. It's okay. We could skip it. It was just a nice quick, infographic 1-minute video that I like, but we do not have to. Okay. And okay, now we need to get to the next slide.
Make decisions.
Okay. All right. So asking the right questions. Okay. So one of the things that as a communication scholar I look at is how we frame our messages and what is the best way to, receive messages as well. And so with that, it's, our questions are one of the first places that, can help aid in information exchange. So one of the things that we really want to make sure that we do when we are with a provider is to use open-ended questions, okay? And when I say open-ended questions, I mean questions that are going to require a narrative response, are going to require a unique response. It is not a simple yes, no, option 1, 2, A, B, it is not a multiple choice answer. It is going to be something that is going to require the provider to explain. And that will help aid understanding. So I provide some examples here. So instead of, asking the question, well, if your provider says, I recommend this medication, instead of saying like, well, is this a good treatment option? well, if they recommend it, yeah, it's a good treatment option, You could say then, can you explain the benefits and drawbacks of this treatment? And that's going to give you an idea, like what are the side effects? What is the, what are the ways that this could help improve quality of life? What are the costs associated with the medication? They can really start to explain those things and break them down in a way that's going to be more helpful to you than being like, yeah, no, I recommend it. It's great for you. Again, write your questions down. This will help to make sure that you are thinking about like anything that you really need to know, like what is pressing. So if you don't understand something about your, loved one's condition, the treatment option, a recommendation, write down what you're confused about and be specific. So, you could say like, I just don't really understand how physical therapy is the best, option moving forward. Can you explain like how this is really, going to benefit my loved one? So with that, this is for you to reflect on what are you confused about and what do you need to understand? Because there might be things that you're completely aware of and they can skip over because at the same time like we don't want our providers spending a ton of time on things that we already know. Sometimes it's important to reinforce some of that knowledge, but other times I found like sitting down with a provider, I went to the doctor a couple months ago and I'm sitting there and he's telling me stuff and I'm just like, okay, no, yeah, I already did that, but what my question for you today is this, like, this is what I need to know. And so, it just, again, it's that being assertive. And it can be hard. It can be hard when you're the patient to have that assertiveness. If you're able to consult with your care recipient before the appointment, and if there's other caregivers involved. So if you're, caring for an elderly parent and you have siblings, consult them, have them be involved in the conversation. Again, this should be as collaborative as possible. And that's hard. It's really hard to be collaborative. It's really hard to, have everybody have a voice in these decisions. They're hard decisions. This is not the easy parts of life. But they're incredibly important conversations to have because, you don't want to put yourself in a situation where you don't have the answers. And like I said, I saw that firsthand this summer where we just really felt like we didn't have the answers. And it was for somebody that we felt we all knew, my grandmother had 7 kids and 13 grandkids and spent a lot of time with her. And we always felt like we just knew grandma inside and out. And then we're sitting there and we're like, I don't know. I don't know how to answer this. So a request for greater clarification with follow-up questions. So if you are finding that your initial response doesn't fully answer your question, be willing to probe further. So, well, what do you mean by that? That's a really great follow-up. I'll use that a lot of times when I do focus group research or interview research. Or can you expand on that? Or let's unpack that a little bit more. Those are the types of kind of probing statements, questions that can be really helpful. And then never forget to ask about next steps and follow-up care. Always, sometimes I found, especially at that end of the appointment when the provider's feeling rushed and they got to get to the next place, is they'll be like, oh, this will be in your appointment summary and you can find it on my chart. And it's like, no, I really need you to reiterate this for me. I need to make sure that I'm understanding I'm going to do X, Y, and Z. So. Okay, so I want to end kind of coming back around. And when I say end, I mean in my lecturing portion of this. There's still going to be time for some discussion and Q&A, but I kind of want to end my lecture portion coming back around to the caregiver role itself and kind of the unique challenges that caregivers face. And key to that is compassion, fatigue, and burnout. It is really hard to take care of another person day in and day out. It doesn't matter if it's a child or, a spouse or an elderly parent. Like anytime you are responsible for another person's health and well-being, and even just meeting their basic needs, it is very emotionally and physically exhausting. And so it's important to recognize those feelings and recognize how they can impact your ability to advocate and communicate and care for your loved one. So some symptoms of caregiver burnout are emotional and physical exhaustion. withdrawal from friends, family, and other loved ones, loss of interest in activities that were previously enjoyed, feelings of hopelessness and helplessness, changes in appetite and or weight, changes in sleep patterns, the inability to concentrate, this brain fog. I know that, as a new mother, I experienced this a lot postpartum where my brain was just like, I was like, I can't, what happened to my brain? It left me. I can't concentrate, just that brain fog from being overly tired and burned out. When we have these experiences, a lot of times it compromises our own immune system and we get sick more often. And that can be a real challenge, like trying to care for somebody else when you're sick. It can be almost impossible at times. And then irritability, frustration, and anger towards others, especially the care recipient. We want to make sure that we're managing our own feelings so that we can be a good caregiver. But if we don't take care of ourselves first, it can be really hard to provide that to another person. These are some stats that I found. I really feel like they're really eye-opening regarding, what caregivers experience by and large. So 20 to 50% of caregivers report depressive disorders and symptoms. So, experiences of depression, like almost, sometimes half are reporting that. Spousal caregivers age 66 to 96 who experience caregiving related stress have a 63% higher mortality risk than non-caregivers. And I truly think that this is, one of those things that, one of those stats that is really scary because, if you step into a caregiving role for your spouse, like it has an impact on your own health and your own abilities and that and your own capacities. And that's really important to keep in mind. Over 40% of caregivers have been providing assistance for 5 or more years, and nearly 1/5 have been doing so for 10 plus years. And so that can mean 5 or more years out of the workforce, not contributing to retirement, not receiving healthcare benefits, loss of income, stress, all of these things that can just create a lot of challenges. Will we be sent these slides? Yes, I'm happy to make these slides available to you. Working women with caregiver roles are 2.5 times more likely to live in poverty when they become elderly compared to their peers. So, if you have a job, but you also have caregiving responsibilities, so if, you're taking care of an elderly parent, that can have a lot of financial costs that can have a lot of impacts down the road. 2/3 of working caregivers have to rearrange their work schedule, decrease work hours, or take unpaid leave to meet caregiving responsibilities. That's a real challenge. I know for myself as a parent of young children, like I am always rearranging my schedule. Like last week we had a snow day and it was like, oh no, I had things I had to do. Now I have to watch you. So, but, I think that it's important to note, like, doctor's appointments, all of these things, transportation, and just keeping up with life, whether it's the house or meals or, just the day-to-day tasks, it really can make it so it's hard to keep a job and fulfill those job responsibilities, especially in today's world. And an informal caregiver, so really, what we're talking about here, is estimated to lose an average of $25,494 in Social Security benefits. And so, these really, again, they have long-term financial impacts on our lives. And I will say all of the links to where the information I pulled from these slides, if you look at, I really like this design of the slide because it was a kind of web page. So the links are at the top of the web page. So, when you get the slides, it should be easy to find everything. So how do we manage these things? How do we deal with this as individuals? First, if you are experiencing stress and emotional weight, it's important that you talk to a healthcare provider about those experiences. Depression, anxiety, stress, they do have real health consequences. So you need to be able to make the time to receive that healthcare for yourself as well. Make time for self-care. And I feel like the term self-care has been really twisted to be some kind of like, a middle-aged woman in a bubble bath with a glass of wine and a romance. That's not what self-care is. Self-care is eating healthy, doing things that, help you de-stress. If it is that glass of wine and a, bubble bath, that's fine. Exercising, getting steps in, getting enough sleep is crucial. Like, make sure you are getting enough sleep. And just making sure that you're attending to your own healthcare needs, whether that's a dentist appointment for a cleaning or, your own well check and yearly physical. It's so easy to say, oh, I'll get to that later. I'll get to that later. But, just putting things off, it's just going to create issues down the road. Don't be afraid to ask for help and really tap into your support system. So, if you have adult children and you're taking care of your spouse, be willing to, ask them to step up and, hopefully, like, if you have that relationship and they have the ability, you can get help. And it can be really hard to ask for help, but you don't know what the answer is going to be until you ask for it. So, that's really critical. And then find local resources, agencies like this one, there's so many great nonprofits. I think I mentioned earlier when I was doing my dissertation research, I worked with Stewart's Caring Place, which is a cancer wellness resource free in the community up in Copley, Fair Lawn area. There's so many nonprofits. There's so many support groups and other resources, even just through our healthcare system. Summa Health is wonderful in terms of the options that they have available. And so, find those resources. Many of them are free to the community, but other ones, you might be able to access through, healthcare coverage or things like that. Okay, so now I want to switch gears and feel like we can't cuts off a little bit of this. I don't know if I can move, see if I can move this on the screen. Zoom. No. Okay. Well, so I like using case studies in my teaching because I think it's always really helpful, but I will read it to the best of my ability. And then I want to talk about, I have some questions that I'd like to hear from you, kind of your thoughts based on the presentation today. So Maria has become the primary caregiver for her 86-year-old mother who has experienced progressive memory decline and struggles. She is with her daily self-care tasks. Today, Mary accompanies her mother to an appointment with Dr. Chen, a neurologist, to discuss whether assisted living might be appropriate. As they enter the consultation room, Maria faces several challenges: how to advocate for her mother's safety while respecting her mother's autonomy, how to ensure Dr. Chen addresses both her mother directly and includes Maria in the conversation, and how to gather the information needed to make an informed decision. Maria knows her mother may minimize her difficulties or become defensive about losing independence, yet she also wants to honor her mother's right to participate in decisions about her own health care. So, what communication strategies do you think Maria should use before and during the appointment to prepare both herself and her mother for this difficult conversation? And anybody who wants the mic can take it. So.
I don't need the mic.
Okay.
I think, okay. So I think that, probably going in there being assertive, like you said, but just, and using the I statements for, and then a lot of times when, and the doctors, they're not doing this on purpose, or when they're talking to the caregiver, then you as the caregiver, well, what do you think, Mom? What do you, how can we, and then like if the mother does get to the point where, combative, maybe defensive, and she says, yeah, and then like maybe the caregiver reminder wrote, yeah, but remember, Mom, you left the stove on, maybe we need a little extra help for you, and I'm kind of concerned, and, maybe bring other siblings in, that kind of communication, in a nice way, telling her just how much you love her, and then also making sure that the doctor includes her in that conversation.
Yeah. Perfect. Yeah. And also I would just say before the appointment, having those questions written down so that, we don't forget anything. And having a conversation with Mom ahead of time to say, Mom, you left the stove on, or Mom, you fell and, I didn't find you for a couple hours, those types of conversations where, and it can be really hard to have those, in a one-on-one setting, but having that conversation ahead of time might be like, okay, well, we don't want to forget this, when we get there. what specific questions do you think Maria should ask to gather comprehensive information about her mother's condition, prognosis, safety risks, and healthcare options? So, what are some questions that could be asked? And I should check online to see if anybody's responding. So, I mean, I would, say, what are we looking at here? What is the diagnosis, or how are we going to, what are some tests available to really kind of determine, what we're looking at here? What are the care options? Is home health care, a suitable option for her at this time instead of assisted living? I mean, like, do we need to jump all in? So, kind of thinking through some of these things and maybe alternative options that might be available to us. And then, my last question, and I think this is the most challenging one, is how do you advocate for your mother's safety needs while still respecting her autonomy and avoiding making her feel dismissed or infantilized? Like, how do we do that? Anybody? Yeah, go ahead. No, it's fine. It's hard with like a hybrid audience.
Well, you know, just saying, okay, so mom, what do you think would be best for you? Do you think that we should get home care, somebody to come in and help you? How are you feeling about this? And then if let's say she said, well, I don't need anything, then you just, like I said before, just kind of give her those reminders. I often, as a social worker, I often have families in my office, and I always try to include the one that needs the caretaking. And the one thing is where I work where they live. So I've seen them, I watched them. So I say, well, remember that time when this happened? And always with respect and everything and love and just being very caring and letting them know, you know what, yes, you're a part of this decision making, like you said, if they can be.
Yeah, I mean, I think that that's what's crucial, but I just want to note it's not easy, especially with the stress and uncertainty and, shared history of family. You can have different type feelings and, whether it's positive or resentful feelings, and those things can really impact these conversations and really create a lot of challenges. So I think it's important to recognize how that plays into, because I think, sometimes we forget that, nothing is within a vacuum. These healthcare decisions, this experience, it is within a broader family context, is within our broader culture and community. We have a shared history with, these individuals, shared values, or maybe different values and perspectives. And all of those things impact this experience that we're having. And, it's really hard. It's not easy. And, I don't ever want to minimize, these types of experiences. I'm going to skip past case study 2, just to kind of move into Q&A. I saw that there were some questions online. So, I want to give anybody here a chance to kind of, questions, comments as well, and kind of have more of a conversation. So any comments, questions? I can see if I can pull up the chat. Sorry, I'm a Mac user, so, okay. Okay. All right. So yeah, online it seems like there's just some people who were providing context at different times. And I think that's useful. I didn't see any direct questions. I saw some things about within like the emergency room and case managers and things like that. But anybody in person or anybody else online want to add any questions or thoughts?
I think that you first start doing the caregiving to establish with the, like just establish with the doctor right away expectations, and so they don't talk over the person, so they don't, and it's not, you don't have to, I mean, I do it with my own doctor. He knows who I am. He knows certain things I will not do. I don't like medications, so he will probably not try to push any medications on me. So if you establish that with the doctor right away, and the who and your mother, well, my mother's like, or do you agree with this, Mom? Is this, what I mean? Establish this with them right away, and I think that leads to down the road caretaking a better experience when you go to the doctor.
Yeah. Yeah. I mean, and that, I can't, I'm not going to go back to the exact slide, but the being able to state our values and our preferences, expectations is part of that. So, yeah, I think that it is important to say, like, if you are a type of person who doesn't want to try Medicaid, like this appointment I had a couple months ago, I went in and I was upfront. I was like, I don't want surgery and I don't want medications. I don't want these medications in particular. So what am I looking at? What are my options from here? And so, just coming in and state, like, those were, it was the first time I had seen this provider. And so I wanted to make sure I set up, like, this is where I'm coming from, and this is why these are my values. This is why I'm coming from there. And, for me, I was stating those things I said, like, I don't want surgery. I have 2 young children at home. I cannot be, put in a situation where I can't care for them, and I can't be put in a situation where something could happen to me. So that's why surgery is off the table for me for this situation. So yeah, I think that's really important. And again, that just comes in with stating, what are your values? What are your preferences?
You want the doctor to know where you both stand,
Yeah.
then they're more apt to listen to you.
Yeah. Yeah. I think that it's really helpful for providers to know, like, what are your limits? What are your goals? And I think then they're better able to meet them. And it's hard because, from the provider perspective, you know, everybody comes in a little bit different, and there's such a range, and it's on so many issues today because, it's our health, but it's also, our beliefs, like, again, when I say culture comes into that can include religious beliefs, political beliefs, all of these things that, we, that shape how we live our lives. It influences, what we want out of our healthcare. And so, as caregivers too, it influences what we want out of our healthcare for our loved one, and their own preferences and values influence that as well. And so that's where, like, having these hard conversations are really important. Those conversations, even just around advanced directives, like, when my kids were born, my husband and I sat down with the lawyer and did all of, living will and everything like that. And I just remember sitting there being like, oh my gosh, like, I can't believe I have to answer these questions. But I know that they're important questions to have answers to. So, all right, a couple questions. So, caregivers need to have an open mind to different options. They need to consider what the spouse or parent would want and not want. Yeah, exactly. Like what we were just saying. That was from Candace. Like, it's just so important. And like I said, it's really hard to have these conversations when everything's great. Like, nobody wants to talk about when things aren't great. Nobody wants to talk about, if something bad happens. And, but it's important to get those understandings. Really respecting his own decisions, even if, even poor decisions. Yeah. So, also, Crystal said, or is that Crystal? Hold on, let me go up. Stephanie said, like, respect, being of sound mind and making decisions, even if you don't agree with them. I think that that's so hard as caregivers, of how do you manage when the person you are caring for wants to do something that you are opposed to, that you have a different attitude towards. That is a real challenge that, like, you have to find it in yourself to respect that person. And it can be very hard. It can be really hard to look at your loved one and say, why are you making this decision? Like, I know I've had to sit down with my parents And, my dad said like, oh, I'm not doing this. I'm not seeing the doctor. And I'm like, Dad, like, well, we really should because of XYZ. And it's like, no, like, and it's so hard to respect and be like, well, I don't agree with it, but if that's your decision, I have to live with it. I have to respect it. So, there was another one that I'm not seeing now. Bridget, did you see that other one under Stephanie's? Okay. Okay. Yeah. Okay. Yeah. So I guess if there's no other questions, I'm not seeing anything else online or in person, but I just wanted to say thank you so much for having me here today. Lori has the slides. So, if you, reach out through your contact here, I'm more than happy to have the slides shared. And my contact information is on this last slide here. You are always welcome to see if I can get to it. Okay, that's the evaluation. So yeah, but here's my contact information. That's my office phone and my email address at UA. I am always happy to, talk to members of the community, provide any support. If you ever are interested in coming to campus and connecting with myself or other faculty or other resources we have related to health communication, please just reach out. We are always looking for more opportunities to be involved and be able to, use our research to help the community. So thank you so much.
I was just about to check this off because then I'm going to be hearing myself and then also talking to myself. All right. Thank you very much for coming on out and for sharing all of that information. It was wonderful and fantastic information. Just a couple of quick ground rules before we get going, folks. And it's much shorter than before, so don't worry, I won't take up too much of your time. So let's see here. This should be the evaluation. Yes. So for anybody that is looking either for CEU credits or not, whether you are in person or virtual, we ask that you please scan this QR code if you are able to and complete this evaluation. It is 100% mandatory and necessary for anybody looking for CEU credits. And you will not be able to get your CEU credits or certificate if you do not do this evaluation. However, we do still ask, even if you're not here for the evaluation, even if you're not here for CEU credits, we do still like to know what we can do to help improve the program. So, and then could you hit the spacebar, please? Thank you so much. And then this, for the folks that are here in person, this is just our checkout form. So if you came in and you checked in because you were looking for CEU credits, this is just the same form. You'll just put in your first and last name to check out. And then once we've got your check-in and check-out and your evaluation, that will be all you need for in-person attendees to get your CEU credits. And then last but not least, because I know a couple of people are asking where they can find this information, you can find any of the information about past and present Caregiver Noontime events on our website. So I do believe that URL should be www.dhad.org. You can also just search Direction Home Akron Canton on Google or whatever your preferred search engine is. It should pop up with, let's see here. Yes, so it should just pop up with the main page. We focus on the person, not the problem. The page you are going to be looking for is under Resources and Education, I think. No, it should be, I could just give you the direct link. So the direct link is dhad.org/I'm a caregiver. And that should be, I want to say, dashes in between those. So I'm -a-caregiver. That has all the information about upcoming events that we've got going on. That has all of the recordings and the slides, all of the information. So if you need that, that will be on our website. And if you are unable to find that, you can reach out to me or to Lori. My email is bmacdonald@dhad.org. Lori's is lsmith@dhad.org. Please reach out to one of us if you have any questions or concerns. But at this time, I do believe that is everything. So unless you have any final... Yeah, if you checked out that QR code and then the full evaluation, then you are set and ready to go. And then for any social workers and counselors that did not hear this earlier, your credits will be uploaded to CE Broker on your behalf. And then anybody looking to get CEU credits, be expecting those certificates, I would say, by the end of next week. So if you do not have those by the 19th, please reach out and we'll make sure that we have, that we've got you covered where you need to be. At this time, thank you very much, ladies and gentlemen, for attending today, and have a wonderful rest of your Tuesday afternoon.